Chapter 10 All About Questionnaires. Pathiel Ravi Shankar, Ian G. Wilson. Abstract. Questionnaires are among the cost-effective and most efficient means to obtain information from large number of respondents. Widely used in educational research. Efficient use of time and resources, anonymity of respondents, use of standardized questions, and a high participation rate are advantages. Adapting an existing questionnaire may be easier than constructing an entirely new instrument. Both open-ended and close-ended questions can be used. Validity and reliability are two important issues to be considered. Qualitative and quantitative are the two basic types of questionnaires. Online questionnaires are becoming increasingly common. Questionnaires can be administered face-to-face using a telephone, through mail, or online. A Likert scale is often used to measure attitudes. Pilot testing is important before a questionnaire is administered. Validating a questionnaire is a complex and time-consuming process. Recruiting subjects and analyzing responses could be challenging. This chapter also highlights attributes of a good questionnaire. Keywords: attitude, research, educational, research, qualitative, research, quantitative, students. Surveys and questionnaires. Assess need. Why are questionnaires commonly used in educational research? Questionnaires are probably the most widely used instrument in educational research. A questionnaire is a research instrument consisting of a set of questions or other type of prompts aiming to collect information from respondents. Both quantitative and qualitative information can be collected using a questionnaire. Questionnaires are widely used in research. They are the cost-effective and most efficient way to obtain information from a large number of respondents. Responses can be quantified and subject to statistical analysis. Questionnaires can be administered to respondents in different ways. They can be completed by a data collector while interviewing the participants. The most common method, however, is for the respondents to complete the questionnaires by themselves. The investigators may be contacted in case of any queries or difficulties. You should certainly know about online questionnaires, which are becoming increasingly common. The main advantages of using a questionnaire in medical educational research are efficient use of time, respondent anonymity, use of standardized questions, and the possibility of a high return rate. Designing a questionnaire, obtaining feedback from the respondents about the questions, and pilot testing the instrument are time-consuming steps. Several questionnaires have been developed, with a few notable examples being Dundee-Reddy Educational Environment Measure, Jefferson Scale of Physician Empathy, Communication Skills Attitude Scale, Self-Directed Learner Readiness Scale, among others. For most educational research purposes, it may be easier and efficient to adapt an already designed questionnaire. However, one must be careful while adapting the questionnaires used in Western countries to the Asian and Indian context. The authors have extensively used questionnaires to carry out research studies in several areas, including student attitudes or perception toward transferable skills, complementary and alternative medicine, the doctor-patient relationship, care-seeking behavior for childhood illness, integrative medicine, psychological morbidity, sources of stress, and coping strategies. Brief. Questionnaires are commonly used in medical educational research. They are more efficient to gather information from large groups with high response rate, maintaining respondent anonymity. The questionnaire data can be analyzed using quantitative and qualitative methods. Various issues should be carefully considered while planning and administering a questionnaire. Online questionnaires are becoming increasingly common in COVID era. A good questionnaire fulfills several important characteristics. CO and 3XTUARIZE. Scenario 1. You are a medical educator at a medical school which was started 3 years ago. The dean of the medical school has requested you to study the educational environment at the school in terms of different parameters like faculty, students, and students' self-perception. The perception of the educational environment among different cohorts of students and according to gender and other demographic characteristics is to be compared. And detailed information from subgroups of students who have lower perception scores is also needed. How will you go about this task? One of the instruments to study student perception regarding the educational environment is the DREEM questionnaire developed in the Western context. This questionnaire has been used and validated in several settings. The scores can be compared among different groups and subgroups of students. Scenario 2. You are the Dean of Clinical Sciences at an established medical school. Students are selected from among the best talent in the country. You have been concerned by anecdotal reports of decline in empathy among medical students as they progress through the undergraduate medical course, and especially by suggestions that the maximum decline may be taking place during the third year when students enter clinical training. How can you obtain a fair measure of attitude and empathy of students, which can help to answer your queries? The Jefferson Scale of Physician Empathy was developed by Harjat at REI to measure empathy among physicians, healthcare professionals, and students. Several studies have been conducted using the instrument globally and also in India. A student version of the instrument has also been developed and used in several studies. Different cohorts can be studied in a cross-sectional manner, and a particular cohort can also be followed longitudinally. These two examples highlight how a variety of parameters can be measured or studied in medical education using appropriate questionnaires. In these two instances, we used previously developed and validated instruments. Describe issues relating to questionnaires. A questionnaire is perhaps the most used instrument in educational research. A distinction is made between open-ended and closed-ended questions. An open-ended question requires the respondents to provide their answer, while in a closed-ended question, the respondent picks the correct one among a choice of options. Two important issues regarding a questionnaire are validity and reliability. We will now examine what these terms mean. The validity of a questionnaire is related to whether it measures what it is supposed to measure. There are two measures of validity, internal and external. Good internal validity means lack of error in the measurements and the possibility of drawing inferences from the data. External validity refers to the applicability of the findings of the study to the population from which the sample was selected. Different constructs of validity have been discussed in the literature. See Table 1. Table 1, Types of validity and what do they mean? Types of validity. Face validity. Criteria. Does the questionnaire look like it will measure what it is intended to measure? Content validity. The extent to which the content matter experts agree on the content. Construct validity. The ability to measure the concept adequately. Predictive validity. The extent to which the questionnaire findings can predict results in future. Concurrent validity. The extent to which the results are supported by using other tests. The reliability of a questionnaire is also important. During test-retest reliability, the same questionnaire is administered at different intervals to the same respondents obtaining similar results. Inter-rater reliability is another aspect and examines whether two individuals using the questionnaire score items similarly. Internal consistency examines the correlation between different items in the questionnaire. Cronbach's alpha is widely used as a measure of internal consistency. A value greater than 0.7 is regarded as internally consistent. Among important issues to be addressed before the start of the study are identifying the target population, the types of questions which will be used, whether the respondents can interpret the questions correctly, writing of individual questions, avoiding pitfalls in construction, language. The sequence and organization of questionnaire, the process of validation and pilot testing. We usually start with more general questions and then go on to more specific and sensitive questions. Demographic information is now often asked at the end of the questionnaire. If demographic questions are asked first, they may be seen as intrusive. If they are asked at the end, respondents may be committed to the questionnaire and are more likely to respond. Types of questionnaires. Questionnaires are divided into two basic types, qualitative and quantitative. Qualitative questionnaires, also called unstructured or exploratory questionnaires, are used to collect qualitative data which is not numerical in nature. An example can be collecting free text comments about a particular class or session. They are usually used in the initial stages when not much is known about a topic. Quantitative questionnaires are also known as formal structured questionnaires. These are used to collect numerical data which can be counted. The data can be subject to statistical analysis. We often use a Likert scale evaluating a respondent's agreement with a statement to convert perceptions and attitudes to numerical values which can be analyzed statistically. These are usually used when we have more information about the subject or topic we are studying. Many questionnaires use a mixture of quantitative and qualitative elements within a standard questionnaire and use of free text comments. There are also computer in-house, telephone, and mail questionnaires depending on how we administer the questionnaire. During the ongoing pandemic, computer or online questionnaires are widely used to collect data. Google Forms, Microsoft Forms, and SurveyMonkey are some freely available resources to create and administer questionnaires online. There are different online sources to obtain information on how to use these forms. The data collected can be directly downloaded in different formats. Telephone interviews can be conducted in a short time, but respondents may be reluctant to answer certain questions over the phone. During an in-house survey, the interviewer visits persons in their homes or workplaces. If a good rapport is established, this can be a good method of collecting data, but it can be expensive, laborious, and respondents often may not be comfortable having the interviewer at their homes or workplaces. Questionnaires can be sent through mail, often with a prepaid return envelope, allowing respondents to answer at their leisure. However, it can be expensive and response rates can be low. Various types of questions can be used in a questionnaire. These can be open-ended and close-ended. Open-ended questions allow respondents to answer according to their choice without imposing any restrictions on their answers. Among close-ended options, multiple-choice questions are commonly used and ask the respondent to select a choice from several options. Dichotomous questions provide respondents with a set of true responses. Use of scales. Scaled questions are used to judge the degree of the respondent's feeling about something. Likert scales, rating scales, and semantic differential scales are different types. A Likert scale measures attitudes directly and is usually a 5 or 7-point scale, allowing the respondent to express how much they agree or disagree with a particular statement. A semantic differential scale asks respondents to rate an entity within the frames of a multi-point rating option. The two ends of the scale have opposite choices. Pictorial questions substitute pictures instead of text and usually has a higher response rate. The process of developing and validating a new questionnaire. As mentioned previously, constructing a questionnaire is a complex process requiring significant statistical expertise. The first step is to determine what you want to measure using the questionnaire. Questionnaires are ideal for determining the prevalence of events or opinions in communities. They can also be used to determine the occurrence of certain illnesses. They work well in screening for illnesses such as depression or anxiety or similar conditions. They can measure latent variables such as quality of life. It is obvious that the structure of questionnaires will vary significantly. Table 2. Writing of individual questions, avoiding pitfalls in construction language. Type of question. Double question. Example. Do you think medical students should have more lectures or experience more clinical work? Issue. Many respondents would like to answer yes to both options. Push polling. Elite medical schools produce better doctors than other schools. There is a strong suggestion which may direct respondents to a specific answer. Validation and pilot testing. Once the questions are framed and compiled, a pilot test should be run to determine the readability of the questions, and the pilot can also be used to conduct the validation of the questionnaire. This is a vital step in the process of finalizing the questionnaire. The validation process determines if the questions are capable of measuring what we want it to measure and if it can measure it reliably. It is only when we can demonstrate that the questionnaire is valid and reliable that we should use it for research. It is because of the complexity of the validation process that many researchers seek to use questionnaires that have been validated in prior research. This must be undertaken with caution. Just because a questionnaire has been validated with one community does not mean it is valid in other contexts. The questionnaire needs to be revalidated. However, using an established questionnaire means that you do not have to go through the process of writing the questions. As a minimum, the questionnaire should be subject to a pilot test. Many quote Cronbach's alpha based on the research findings and assume that this will validate the instrument. Cronbach's alpha is important for reliability, but it does not confirm validity. A pilot test will enable you to determine the acceptability of the language for the subjects of the study. It will also enable you to explore the validity of the questionnaire. Validating a questionnaire is a complex process. It covers face validity, where context experts examine the questions to determine their ability to measure what they are designed to measure. It also determines that subjects read and understand the questions in the way they were designed. Validation also measures reliability, as this is a basic requirement of a valid instrument. The scores are also examined in detail to determine their structure and relationship to other measures and the ability to predict scores in other areas. Having developed and validated the questionnaire, it is now possible to conduct the research. Determining and recruiting subjects. The first step is to determine who are the subjects. Developing a sampling frame through determining the selection criteria for the subjects ensures the subjects have a degree of commonality. Decisions then need to be made about how subjects are recruited. Options include telephone recruitment with interview by a researcher, posters, advertisements in newspapers or magazines, online through websites. Recruiting students can be through lectures and during other sessions. Recruiting students directly requires ethics committee approval. It is likely that you sit in a position of authority over the students, and the methods used will need to ensure this does not affect the recruitment. Sampling frame for questionnaire studies. The sampling frame is determined by the criteria used to select or reject respondents. Often a convenience sample is obtained. The sample should be representative of the population being studied. Issues of sampling have been addressed in detail in other sections of the book. Random sampling, systematic sampling, stratified sampling, and snowball sampling can all be used. Snowball sampling is often used for sensitive topics where it may be difficult to recruit participants. Compliance issue and tips for enhancing compliance. Questionnaires are self-report instruments, and this limitation must be taken into consideration in analyzing the results. The questions must be in a sequence that helps the respondent understand what is being considered. Easier questions should come first so that the respondent feels more comfortable responding. Compensating respondents for their time can be considered. The amount offered should not serve as an inducement to participate. Analyzing the responses. Having recruited the research subjects, it is necessary to organize the data into a form that enables it to be managed and analyzed. Questionnaires completed online can be easily converted to a spreadsheet to enable analysis. Paper questionnaires need to be entered manually, although it is possible to design them so that they can be scanned. If they are to be entered manually, it is possible to design the questionnaire to help the data entry person ensure the data is entered correctly. If ensuring the quality of the entered data is critical, then double entry with comparison of the data sets will ensure the final data quality. Having created the data spreadsheet, analysis can occur. The researcher may want to enlist the support of a statistician if they do not have sufficient skills themselves. If the use of a statistician is planned, it may be best to enlist their aid during the development of the questionnaire. Box 1 lists the characteristics of a good questionnaire. Box 1. Characteristics of a good questionnaire. Characteristics of a good questionnaire. Professional looking. Title is informative and clear direction on completing the questionnaire are provided. Short and easy to read. Purpose of this study is explained and the reasons why respondents should participate are provided. Unambiguous and terminology used is easily understood by the respondents. Questions grouped logically, arranged according to themes. Easy questions are asked first and demography is asked at the end. Branching is clearly shown. If some questions do not have to be answered by some respondents indicated clearly. Capitalize, italics or font types can be used to deliver instructions. Provides alternative but does not use double-barreled questions. Questions are worded neutrally and do not lead the respondents to answer in a particular manner. Ask both closed and open-ended questions. Most questionnaires ask for open comments towards the end. Title should be concise, reflect the contents, and be easily understood. A cover letter is attached with the questionnaire explaining details about the questionnaire and mention about confidentiality of responses. The questionnaire should end by thanking the respondents for their participation. Summarize. This chapter has demonstrated the use of and the complexity of devising high-quality questionnaires. Questions need to be aligned with the purpose of study, research questions, and the target audience. High-quality questionnaires need to undergo a thorough validation process. Using an existing questionnaire requires revalidation for the subjects in the new research. While questionnaires in quantitative approach help in describing and explaining the situation, the questionnaires in qualitative approach can provide exploratory data. Questionnaires can be combined with other methods. Qualitative questionnaires can be devised to collect information that will provide more exploratory data. Evaluate. Imagine that you have to conduct a questionnaire-based study to assess the attitude of health profession students toward interprofessional learning. First, carry out a literature review to determine if there is an already existing questionnaire which can be used. If a questionnaire needs to be developed de novo, undertake a literature review to determine the questions that will be required. Does the questionnaire meet the characteristics of a good questionnaire mentioned in Table 1? Does the questionnaire require modification for use in your context? How will you pre-test the questionnaire? Will the questionnaire be administered in English? If not, the issue of translation should be considered. How will you go about obtaining ethical approval or exemption for your research? Will you administer the questionnaire using paper forms or use an online form? How will you motivate students to participate? When will you close the survey? How will the data be analyzed? How will you maintain anonymity of the respondents? How will you communicate the findings of the study among internal stakeholders? How will the findings be communicated externally? Kindly think through these steps for the two scenarios and instruments we have described in the contextualized section of the chapter. These steps are important when you are doing a study using the REM or JSPE or any other questionnaire and will improve the logistics, the method of the study, and the quality of the data obtained. Figure 1 highlights the important steps in developing and using a questionnaire. Figure 1 Developing and using a questionnaire in educational research. Decision to use questionnaire as preferred method. Develop a new questionnaire. Modify an existing questionnaire. Decide on the construct to be studied and group into themes. Write to the original developers. Obtain written permission for copyrighted work. Depending on the importance, decide on number of questions for each theme. Adapt the questionnaire to your local setting. Frame questions following standard guidelines to test the questions among individuals of your target population for understanding. Pilot testing validity and reliability analysis, translation and back translation. Pretest the questionnaire. Validation and reliability analysis. Factor analysis. Administer the questionnaire after obtaining written informed consent from respondents. Analyze the results manual, computer divided by software based. Encourage participation. Communicate the findings.